Thank you for coming here and taking our invitation.
Thank you. It's my privilege to be here. It's an honor.
So you have been to 200 countries already, and also you have been worked for more than 30 countries on suicide topics. So it means you have great experience in suicide. So can you share us a bit about how is the world according to the suicide?
Well, suicide is a problem everywhere, and it's particularly a problem in developing countries where most of the population lives. So we think many times that the rate of suicide is much higher in boys, but in fact in China and in India, where most of the world lives, that's the largest populations, it's 50-50. So it's a mistake that we make everywhere to ignore the girls and to think only about the boys because the rates seem to be higher. And they are generally higher. And why are they higher? They're higher because everywhere in the world, boys and men use more lethal means. They use firearms, they hang themselves, they use car crashes. Girls and women tend to use less lethal means, and so they can frequently be saved. They may cut their wrists, they may take an overdose, and they can be saved. So they tend not to die as frequently. But the rates of attempted suicide are not so different between boys and girls, men and women. So that's one of the mistakes we make, is to ignore the girls. So there are major problems that every country faces. Stigma, for example. People are stigmatized if it's known that they had tried to kill themselves or try to hurt themselves. People have died by suicide, the family is frequently stigmatized. So we don't talk about suicide. But what we have learned from research is that talking about it is very, very important. Very important for people to understand suicide and to know about it and to know that there's help. So one of the things we know here in Mongolia is that there's a great effort now to address the problems of suicide. And there are many different things that can happen. Some of them require resources, some of them don't require much resources. It's not the end of the world or the most expensive thing to think of how we can raise awareness. Awareness is very important. Anti-stigma is very important. We can do those things without spending a lot of money and save lives. So one of the things that we need to do in every country is to raise awareness about the possibility of help and inform people where you can go for help. Everyone should know that if they're having troubles and they're thinking of hurting themselves, who they can call, who they can turn to, whether it's a teacher or it's a therapist or it's a neighbor or it's a clinic. But if people aren't told that these are options that are available, they may think, I'm the only one that has this problem. No one else is thinking of hurting themselves, just me. We need to educate people that this is a very common phenomenon, to think of hurting yourself. To actually going to the next step and hurting yourself is more rare. But if we can get to people before they hurt themselves and inform them how they can get help when they're only thinking about it, we can save lives.
So she's confirming that in Mongolia also we have higher suicide among men, and men are likely to die from suicide 7 times higher than women. So in your research it said women are likely to attempt suicide, same to men, but they likely to not die from it. So is it same in Mongolia? What is your research saying? Is it true? Is it okay to we are going to understand like that? Mm-hmm.
Well, one of the problems is that who gets counted as having killed himself? And we know in many places in the world, and it may be true in Mongolia, it may not be true, is that when women kill themselves, frequently it's misclassified. And why? Well, for cultural reasons. It's very difficult to tell a child that their mother killed themselves. It's a lot easier, not easy, but it's easier to say that your father killed himself or your brother. because of the roles that men and boys have in society versus the roles that girls and women have. So many times, and we know this from research, many times women are misclassified. They died of a heart attack. They died of natural causes. Because we don't want to, because of the stigma, we don't want to say that women died by suicide. That doesn't mean, and I have no evidence, that boys and men aren't dying in much greater numbers here. But what we do know is that throughout the world, it's frequently misclassification of women, which makes it look like women are dying or hurting themselves much less than men. I don't know that that's true here, but I would suspect it is. So the example I can give you is India and China, where most of the world's population live, and it's about 50-50. We do know that men attempt suicide much more than girls. I mean, women attempt much more than boys. Boys are more successful because of the lethal means that they use. But the answer for Mongolia, why the young men are killing themselves, I think it's probably not so different from why the young girls are killing themselves. There's tremendous pressure, there's bullying, there's expectations that may not be realistic, there's family violence. Substance use is a major problem in Mongolia. Families that have substance abuse, those children, those family members are at risk for suicide. Family violence, family members are at risk for suicide. So there are lots of sociocultural reasons why people are more likely to be at risk for suicide. And those things need to be studied and addressed. And one of the ways to do that is to gather very good data. And we talked about that in the conference on Monday, and I talked to the Minister of Health about it this morning. Mongolia is very fortunate that you have what's called a REDCap system. It's a platform for collecting very good data, and there are in fact REDCap servers here in Mongolia. There are 5 or 6 of them, but they're not currently being utilized for the country. They're being utilized for specific programs. They need to be brought together, and they need to be utilized for understanding the data throughout the country in Ulaanbaatar so that programs can be targeted better. What's going on in the schools, who's presenting themselves in the clinics, who's presenting themselves in the schools. If we have good data, we can make a better choice about how to provide limited resources to prevent suicide. So data is important, and again, Mongolia is very fortunate. They're way ahead of many countries. The REDCap system is being used now in 164 countries. It's simple, it's free, and it would allow Mongolia to compare itself to Japan, compare itself to Korea, compare itself to China, because everybody's using REDCap. Mongolia should start using REDCap on a national basis so that you know where you stand in the world and you know where you can target, where you should target limited resources. So the UN, as you probably know, just last year incorporated suicide and mental health as one of its objectives. That's really important because it's now being viewed as part of the non-communicable diseases, which of course it is. But now there are resources flowing for non-communicable diseases, including suicide. Well, using a REDCap system, you could collect all of that data together. You can collect the diabetes, the cardiovascular information, all of that information together and start figuring out how best to target people and places in regions in Mongolia for suicide prevention, diabetes prevention, cardiovascular. It all goes together. And that brings me to the next point, which is how do you bring everybody to the table? This is not a problem for psychiatry, it's not a problem for teachers, it's not a problem just for parents. It's a problem for all of us. And how do you do that? You need to do it by awareness, and you need to do it by training. Everyone needs to understand what the dimensions of suicide are so that we can all work together on it.
What is the suicide warning signs? Because right now, most likely the teenagers and young adults are likely to take their own lives. And what is the reason behind it? And how can we prevent from it? Is it true that if the one person gonna have deep or heavy stress, then at the end they are likely to end their own life? So how can we prevent from it? And how can we identify that our best friends or my family member are in a high risk of suicide?
I think that's the most important question. We don't know why individuals kill themselves. We do know after the fact why they probably killed themselves. There are things we can do to reduce suicide. Awareness. For example, you can have awareness programs in school so that you talk about it and you get children, where you have the highest rates of suicide in Mongolia, you talk about it and you develop a sense of purpose and responsibility for themselves and their friends. So one of the things we know, for example, if two teenagers talk about suicide, it's a common conversation throughout the world for adolescents. They talk about suicide, and then one day, one of them decides, I'm going to kill myself. And they tell their best friend, their very best friend, but because you're my best friend, and I'm going to do this tonight, but you're my best friend, you're not going to tell anyone, right? And you say, no, I won't tell. The next day, that person may be dead, and the person who didn't tell has to live with that for the rest of their life, that they could have saved that person's life if they had told. Now that's a very simple message that adolescents don't get told. They don't get told that if you're really a person's best friend, the most important thing you can do is help them when they're in crisis. It's an easy lesson, and everybody understands it. But if we don't talk about it and we don't address it, then nobody thinks about it. The only thing a child thinks or an adolescent thinks is, I'm my best friend's best friend, and I'm not going to tell. But if you raise this as an issue, of course I'm going to save my friend. Very simple. So there are, again, it's part of talking about it. It's part of awareness that everyone has a role to play. Everyone. You can try to talk about with your friends. If someone tells you they're in trouble, you can help them find someone. We can make resources more easily available. Everyone should know a help number. So many countries, the United States just did it a few years ago, many countries have done it for many years, is to create a hotline. Everybody has a cell phone. All the kids have cell phones. You create a national helpline, and someone's wanting to hurt themselves, they call a number, and there's somebody on the other end, and that's a responsibility that the government can very easily assume. 24-hour coverage. Somebody calls that number, you can intervene. You can intervene on the phone, and people will call. Every country that has set up one of these hotlines, they're used all the time. People are calling all the time. Old people who are lonely, they call. I have no purpose in life, I want to kill myself. Adolescents call, I flunked my exam, I'm going to kill myself. There are a myriad of reasons that people get the idea they're going to hurt themselves. And if we could give them a number and let them call, it's a very simple thing to do. It's not that expensive. And the number goes through. It's a way of intervening. So there are lots of things we can do. We can have school-based intervention. We can have hotlines. We can do training programs to train people, whether it's the dentist or it's the pharmacist or it's the teacher or it's the cardiologist. We can train people how to recognize and to have conversations with people so that we identify people early and we can intervene. I haven't seen any situation where every life is saved, but I have seen programs in countries that have brought the numbers down. So if you look at go ahead, I'll wait until you've said. So if I may, I met today with your new Minister of Health, very impressed. And I met with your new head of public health. Again, very impressed. They are both committed to working on suicide. So I think, the country has a great advantage to move forward rapidly. And I think you need to appreciate that every country is rated according to their rates of suicide. And if you look at the top 10, there are countries that were on the top 10, they're not there anymore. For example, Hungary. Hungary used to be the highest rate in the world, and it was on there for many years. It's not on the top 10 now. It's way down in, I don't remember where it is, but it's way down past 20. Sweden used to be up in the top 10. It's way off the list. And how did that happen? It happened because wonderful ministers of health, wonderful heads of public health, wonderful heads of public health psychiatry got together. No one can do this alone. Education departments, labor, everyone has to come to the table and say this is a number one priority for our country, and figure out how we can work together to bring this rate down and get off of the list. I work in Guyana, a small country in South America. It has been the first, second, or third for more than 20 years. More than 20 years. And what I have gotten the minister to understand is our job is to get off the top 10. This is not a list we want to be on. We don't, when people look at the top 10, we don't want to see Mongolia on there. Right now, Mongolia overall is down at 18. But if you look for the youth suicide, it's up there 1 or 2. We don't want Mongolia to be there. We don't want anyone to see Mongolia when they look at the suicide rates. And that's a commitment that, you can't do it by just me or you or the education department or the minister of health. It can't be. Everybody has to come to the table. And that means labor, non-communicable disease people, educators, labor, everyone has to understand that this is a national crisis that we have to address. And we can do it. We can get off of that list.
So if someone who has already suicide ideation or who had already attempted suicide in their life might be watching our content in somehow, somewhere in some time, and then what would you advise to them? What is your advice and recommendation to them? Can you just give them advice?
Well, I think the advice for anyone who's thinking of hurting themselves. Well, I think the advice for anyone who's thinking of hurting themselves or has already hurt themselves, the advice is always to find the person who you can communicate with, to talk to about this problem. It may be a teacher, it may be your doctor, it may be a nurse, it may be a neighbor. It's important to talk about what's bothering you and find help. And it's depending on where you are in the country, the question is what's available, but there's always somebody available. There's always a number. Maybe it's the police, maybe it's a neighbor. But I would suggest if anyone is considering hurting themselves, that you talk to someone, find someone that can be helpful. It's not necessary. There's always an alternative to hurting yourself. You don't need to hurt yourself. There are other ways to find a solution to the problem. Most problems are not as big as we think they are. You fail an exam, you lost your boyfriend, you lost your girlfriend, you lost your car, you didn't get what you wanted for your birthday, whatever it is. There's violence in your household. A family member may be abusing you. You may have a family member or a neighbor who's an alcoholic. It's not an uncommon problem. There are solutions. There are ways to deal with it. And I would encourage everyone to find that solution by talking to someone where they can get help. There's always help, even if you think there isn't, and even if you think that the problem you're having is so terrible and it's only your problem. I can assure you there are thousands of other people who have had similar problems, and they got help, and they didn't hurt themselves. And you shouldn't hurt yourself either. Get help. Get out of the situation. Find somebody you can talk to. And I think it's also important, if you're thinking of hurting yourself, you may tell someone, and that person, whether it's your mother or your father or your neighbor, may think, well, you don't really mean it. Take it seriously. If you're the mother, you're the father, you're the neighbor, you're the teacher, and if you're the friend, and the person tells you that they are considering hurting themselves, killing themselves, take it seriously. Help them get help. Talk to someone yourself. Find help for that person. So there are two groups of people that frequently talk to people who are in trouble. Those are nurses, they talk to all the patients, and teachers talk to all the children. Those are two people that should be trained on how to respond, how to take action. Those are two critical professional groups that are frequently left out. They are critical for helping us turn this around for children and for adults. We need to recognize that there are lots of people who interact. Nurses and teachers are two of the big groups that talk to children, adults, about how they're feeling. And we need to do a better job of training them to take action. It's not trivial. It's not a minor problem, and you cannot tell people, oh, you'll feel better tomorrow. Take it seriously.
So according to your talk, she is understanding that the communicating and talking is the most important way out to deal with the suicide. Then recently, people are using their cell phones or computer to the social media, and they're just posting or commenting and releasing their stress towards it. But they are not having genuine, they're not having communication in real life. So what is it? Obviously, it is different having real life conversation and having through the social media. So can you emphasize what is the difference between real life conversation and tell us, make it important to us? I wish I computer to the social media, and they're just posting or commenting and releasing their stress towards it, but they are not having genuine, they're not having communication in real life. So what is it? Obviously, it is different having real life conversation and having through the social media. So can you emphasize what is the difference between real life conversation and tell us, make it important to us?
I wish I could. It's a very challenging topic that's being researched and discussed in all over the world. What to do about the problems related to children, particularly, and adolescents, utilizing the phone as a place to discuss everything and having no feedback in most cases, no positive feedback, and in many cases getting tied up in a very circuitous set of discussions that are destructive. It's a real problem. And I certainly don't have the answer, and I don't think in the field we have the answer. We're trying to study it and trying to understand it and see what we can do. There is no answer today, but it does require, we do know, it does require that parents limit the use of cell phones for social media. The social media is just not necessarily the best place to get help. And frequently people get into trouble on cell phones. We are hoping that we can develop better response systems on the telephone, and there are many people working on that. So people can actually go onto the cell phone and get the kind of immediate help that they need. And there are some programs that do that, but it's in its infancy, and we don't have an answer yet. But it is a problem, a real problem. But again, I think having teachers and parents be better informed so that the conversation can take place to counter what may be happening with the cell phones. At the moment, that's really the best we have. We can do all kinds of awareness and we can have conversations. It means people need to have the knowledge to share and to talk about it. And that's, again, awareness and training. And we can do that. Again, it's having alternatives. So if you are thinking of hurting yourself and you know of no alternative, you may go ahead and hurt yourself. If you know there's a number to call, or you know that there's someone to speak to, you may not hurt yourself. It's the same thing if people are using the cell phones and they're having a problem with what they're interacting with the cell phone, and they don't know anything else, and the schools are not having those conversations, and the parents are not having the conversation, there's no alternative. So we, as adults, educated people, we need to provide alternatives and information that gives every child, every adult, an alternative to what they may be hearing on the cell phone.
About the hotline, are you telling about, is it a number that we can call, or also you meaning, is it like, for example, like a chatbot? You can just text and then get a response, altogether the same or different? And why is it so important? Because do we need to implement it in our country? About the hotline, are you telling about, is it a number that we can call, or also you meaning, is it like, for example, like a chatbot? You can just text and then get a response, altogether the same or different? And why is it so important? Because do we need to implement it in our country?
I would strongly urge the Ministry of Health to think about doing this. It's been implemented. It's in many countries in Europe, and it's been there for many years, and it's very helpful. They have just recently implemented it in this little country in Guyana. 2 years ago, we implemented it finally in the United States. And it's very, very helpful, because many times, very frequently, a suicide is a impulsive behavior. And if you have somebody immediately there to respond, then it's very helpful. So somebody is informed that they have a number they can call, they're thinking of hurting themselves, they dial a number, and they get somebody to talk to, and if not, you can set up a text system. Either way, but they get an immediate response, and that's the advantage. So most countries in the United States and Guyana and European countries, it's a national number, it's a simple number, 311, 587, whatever, and that becomes a publicized number, and everybody knows it, whether it's the grandmother or the child, that's a number you can call for immediate help. And on the other end, you have to have people who can respond, educated people who can respond, and they can help you figure out where to go depending on where you live. It's an immediate response that deals with a country that doesn't have psychiatrists in every corner, and that's most of the world. Most of the world does not have mental health specialists everywhere. So how can you provide mental health services? The telephone. And the telephone, if people can call, it's called, usually it's called a hotline, a mental health hotline. And it's very effective, very effective.
So she's asking, how shall we report about the suicide through the media? Is there any protocol on that? Because right now in our country we have one hotline service called 1800 and 2000. I think you've been visited in that hotline room in the National Center for Mental Health. And so it means we need to broaden its utilization, because it's now a little bit restricted, not everyone knowing the number. And also during the COVID time, in our media likely to report every day. Today we have such number of cases of the COVID and such a number of deaths because of COVID, and every day we had such news. And during that time, many people called our hotline service and telling they have hypertension or some anxiety or depression, or they have a lot of nervousness or worriness. So was that a good idea or bad practice? What do you think, and how shall we report?
There's two parts of that, and telemedicine, which is the creating a system of people calling in and they're calling in about a problem with their heart, or they're calling in about their diabetes, or they're calling in about medication. That's a wonderful system that is going into play all over the world, where people can call, they can't get there, they don't have to drive, they don't have to sit in a waiting room, and they talk to a doctor, they talk to a nurse, they talk to some kind of specialist, and they get help. Telemedicine is wonderful, absolutely wonderful. The other question about the media and talking about suicide, there is a very clear set of protocols for media, and one of the first things that any country that wants to address suicide needs to do is to stop publicizing suicide. It frequently, in many countries, it shows on the first page, it shows on the television, it becomes a drama, and it also is widely publicized if a famous person kills themselves by suicide. That becomes part of the media. So there, yes, and I would be very helpful, very willing to send you the protocols about what media should and should not be doing for suicide. It's a very well-developed set of protocols, and it's very simple about what you should not do and what you should do in the media, whether it's TV or the newsprint or whatever. The third question you asked was about, was it a good idea for COVID? Everybody was doing the best they could with COVID. In the United States, we certainly publicized the numbers all the time. It was part of informing people, part of awareness, part of trying to get people to understand the seriousness. It's a very different thing than suicide. I mean, that was a whole different set of parameters when we had a pandemic. And we did want everybody to know, and we did want everybody to take the precautions. So what's right or wrong, I think it was better that we kept everybody informed about the crisis. It was a fast-moving pandemic, and people needed to know what to do. So yes, and the issue about telemedicine, it's certainly something that you want to think about doing. Yeah, I just want to be clear that there are two different things. Telemedicine is a service for providing treatment intervention for people for a range of physical problems, psychiatric problems. A suicide hotline is very different. It needs to be a targeted intervention that is available for people who are considering hurting themselves or killing themselves, and it should be publicized as a suicide or a harm call center. That it's an opportunity to get the word suicide out there in the public domain, that people, in fact, the ministry is doing something about. We've created a helpline where you can call. We don't want you to call because you've got a backache. We want you to call because you're thinking of hurting yourself. And it takes a while, once you implement it, to sort all these things out, but you want to use this hotline for suicide prevention. And people will come to know very quickly that this is a helpline for suicide. And it also gets the word suicide out there in the public domain, that suicide is a national problem, we're doing something about it, and here's the number to call.
So what are the common public health reasons that leading to suicide? Is it true that somebody has a deep stress, then they're likely to end their own life? What do you think? What are the main causes of bleeding?
Well, there are a number of problems, and they're different. Partly they're driven by culture. So what is a common problem here may not be the same common problem in Argentina. They're different by age. So if you're an elderly person and you feel you're a burden to your family because you're no longer bringing in an income, you're no longer able to take care of the grandchildren, you're a burden, they're taking care of you. That may be a reason. That's not a common reason for a 14-year-old. So it differs by age, it differs by culture, by region. There are some common factors: loneliness, isolation, feeling that you're not welcome, being bullied, being sexually abused, being in a family that has a substance abuse problem, those kinds of things, that you're a failure, that you have no value. I mean, these are the things that you would imagine are reasons if, in fact, a person starts believing that that's what defines them, that they're a burden, that they aren't loved, that they're a failure. Those are the kinds of things. Mm-hmm. And I'm being bullied because I deserve it. You know, I can't stand it anymore. I deserve to be bullied, and therefore I got to get out of it. So there aren't any. There's no magic list, and there's no prescription for saying if these things exist, you're going to hurt yourself. It doesn't work that way. Again, it's important to recognize that part of it is culturally driven, and getting off of that top 10 list. So Japan, for example, Japan used to be on the top 10. They're not on the top 10 anymore. Why? Because they looked at the data and who was in fact killing themselves, where were they? It turned out in Japan that it was overwhelmingly the elderly in rural areas. So what did the government do? They set up centers, and they went around with buses and they picked up the elderly every morning and they brought them to these community centers. The elderly who now had been isolated, separated, because most of the rural areas of Japan, the younger people have moved out, the elderly are there, they're isolated. They started bringing them in on a regular basis to these centers. They're no longer on the top 10. Every country has to look at their data, who's killing themselves, who's harming themselves, what's the region, what are the risk factors for that particular group, and what can we do about it? It's not rocket science. It takes a self-examination of a country, of the culture, of your religions, whatever it is that's impacting those rates, and then addressing them. It's not beyond reach. It's not beyond reach. So, as I said, there are many countries that got themselves off of the top 10 simply by having a committed government that says this is an important problem and we're going to solve it. And then there's not one thing that's going to solve it. In Japan, it happened to be an important thing. But it's never one thing. It's a lot of things. And everybody has to come to the table. Again, labor, education, medicine, mental health, everybody needs to come to the table, and we need to talk about it.
Can you share that research that you have been done before, but in the countries that's similar to Mongolia? It might be interesting to us. Mm-hmm.
Well, there's no country like Mongolia. Every country is unique. And what we find is that, you know, there are always differences by religion, by race. It depends on the country or the culture. So if you look at Tajikistan, for example, it's a small country, and it had, all of a sudden, it started having elevated rates of suicide in young girls. And they wanted to know why. So we did a study, and it turned out that this was a country that had traditionally been Muslim, but not practicing. And then that started to change. And as that changed, the young girls came to the conclusion that their life was going to be not what they were expecting. They had been watching television, and they saw the outside world was now something that they were going to be part of. And all of a sudden, for a variety of reasons, that started to change. And the young girls decided, I don't want this. And they started harming themselves. So every country, you need to look at it separately and see what is it about that culture, what is it about the religion or the lack of religion, what is it that's going on? And that goes back to the issue of data collection. So what we know is that there are high rates of suicide in young people in Mongolia. But we don't know, I don't think we know, where and why and what are the things we might be able to do differently, whether we're in Western Mongolia, or Eastern Mongolia, Northern Mongolia. And that's why it would be important to have a good data collection system throughout the country and to do a national study, a longitudinal study, so that we can look over time. How are we doing? What are the problems? How differently are people affected in different parts of the country? And how can we use that as a way to providing interventions? And those interventions may be different for different parts of the country, but we need the knowledge, and that's data. So it's it all comes together. The more data we have, the more knowledge we have, the more conversations we have. We can address stigma better if we understand what's stigmatizing, who's stigmatized, what are they thinking. But we have to ask those questions and then do something about it. And what may be stigmatizing here may be very different from what's stigmatizing in Argentina or Tajikistan or Guyana or New York City. And we have to find out what's unique here and then act on it.
So our interview is coming to an end now. So everything you shared with us is very interesting and it was very crucial to us. And at the end, is there anything you would like to add or emphasize to us and tell us about this topic? Maybe she didn't ask or...
Well, there's a couple of things. I think reducing suicide in Mongolia is very doable. Very doable in part because you now have a committed Minister of Health and you now have a new leader in public health. And I have talked to many of the people who are in psychiatry here who are very eager to take action. So I think you're in a wonderful position to utilize these resources. And you're also You also have this great advantage of having REDCap in the country, so you can immediately start pulling that together and utilizing that. You have a media that I hope would be on board to facilitate this. The media is critically important. There's lots of opportunities for the media to influence the country positively about how to prevent suicide. And if we recognize that all of the people who have a major role of interacting with the public, it's the public we're talking about, whether it's nurses or doctors or teachers or the media, they need to be trained. And that's something that there are protocols for doing. And it's simple enough to do. We just need to decide to do it and then do it. It's not, I always say, it's not rocket science. It requires everyone coming to the table, and it requires doing some very basic things. Nothing that's, we don't have to operate on people. We just have to get, part of the job is to get people to talk about it. That's a big job, but very doable.
You were a very valuable guest to our podcast, and we are very happy that we have achieved to meet you while you were in Mongolia. So thank you once again, and thank you for your valuable advices and comments.